Well, World Autism Awareness Day is today.
So today's the day, but the whole month is dedicated to increasing understanding and acceptance of people with autism. According to the CDC, 1 in 44 children in the U.S. has autism. This includes 1 in 27 boys and 1 in 116 girls. Autism spectrum disorder, ASD, is a developmental disability caused by the differences in the brain that affect people, the way people communicate, interact, and learn that sometimes are different from most other people. And this hits very close to home for so many families, including our Today in the Bay family and Carrie Hall, your family.
Yeah, so as a lot of people have been following my story, I have 2 children on the autism spectrum. And let's talk about some of the signs that you may see with your child who may have autism spectrum disorder. It's called the spectrum because the abilities of people with ASD can vary significantly. Autism begins before the age of 3 years and can last throughout a person's lifetime. And although those symptoms may improve over time, if you are trying to diagnose it, you want to look for certain behaviors, which include avoids eye contact or doesn't keep that eye contact for long periods of time and does not respond to his or her name by the age of 9 months, and also does not show facial expressions like happy, sad, angry, and surprised, and by 9 months of age, not seeing any of those signs. Does not play simple interactive games like pat a cake by 12 months of age, and uses few or no gestures by 12 months of age. For example, does not wave goodbye. He or she may be also very sensitive to loud sounds or may flap hands in excitement. There are a few behaviors that may happen that don't seem appropriate for that particular situation, and because there's no medical test, pediatricians look for those behaviors or missed milestones. And some people with autism may have advanced conversation skills like my 12-year-old son KJ, whereas others like my 7-year-old daughter Bella may be nonverbal. Some people with ASD need a lot of help in their daily lives. Others can work and live with little or no support. Now, my daughter also has stomach issues and severe acid reflux, which caused her to stop eating 2 years ago. A lot of people ask, how is she doing? She's doing much better, but still requires her feeding tube in her belly. And her development is making leaps and bounds thanks to the therapy that she gets 3 hours a day, 5 days a week. And I found that the Bay Area has a huge community of support, which has been so helpful. That's her and her little sensory swing. That's my son cooking with my mom. And, you know, if you are a caregiver of someone who may be on the spectrum, be sure to lean on that community for resource and guidance. It seems like that information to help you along with caregiving for someone on the spectrum is so spread out. It's so hard to find. So it's definitely important to reach out to people around you, and it really does help. People have a lot of information that they like to share, and you know, it can be difficult, especially in those early stages of noticing that something is just not quite right.
And that's when community comes in and really does help.
And you've really become such a big part of the community. You've shared your story, you've shared your struggles, on both ends of the spectrum, right?
Yeah. And some people remember when I was pregnant with my daughter Bella. That was 7 years ago.
Right?
It's so hard to see that time is really flying by, but it's really been helpful to everyone who's supported me, and even just reaching out to say thank you. And that means a lot.
Well,
thank you.
Bringing that conversation to us has enabled, I don't know, for me to have conversations with other people as normal conversations instead of me not knowing what to say, and then it just stops. It gets uncomfortable.
Yeah. So thank you for empowering us, Carrie.
Thank you. All right, so we're going to have some beautiful